If you haven't heard the news, it's true. The Medicare donut hole is history. It's gone, ladies and gentlemen. But what does that mean for Medicare prescription drug coverage? Well, in this video, I'm going to walk through with you exactly what we're looking at for the new Medicare prescription drug layout for 2025. So let's just kind of jump right into it. My name is Christian Brindle. I run a company called Christian Brindle Insurance Services, also known as Everything Senior Insurance. We specialize in working with individuals just like you on their Medicare health plans. We're licensed in 45 states. We'd love to work with you. There's no cost, there's no obligation to work with us. So if you watch all the way to the end of this video and you feel like we know what we're talking about, feel free to give us a buzz. We'll talk about that more at the end. So let's talk about this, right? The donut hole being gone in 2025. So the donut hole has been around since Medicare Part D has been around, right? 2005, 2006. Is when Medicare Part D first came into the fray. Now, for any of you that have ever been in the donut hole before, you know it's not a fun thing. You hear the term donut hole and you're like, oh, I like donuts, I like donut holes, this is great. No, it's not a good thing whatsoever. What it means is Medicare has historically had stages of drug coverage that you move through over the course of the year. And essentially the way that it works is when you reach a particular stage, it's based on your usage of prescriptions, right? It's based on how many claims you run through the prescription drug plan that you have. And this was designed by Medicare, the Centers for Medicare and Medicaid Services, and implemented and standardized into all Medicare prescription drug plans. No matter whether you got your prescription drug coverage in a Medicare Advantage plan or whether you got it on a standalone Part D prescription drug plan, didn't matter. The donut hole was universal. You really could not escape it if you were taking any type of large cost prescription drugs. So what would happen is when you had a lot of prescription drug costs that would run through the plan, you'd move into a different stage of your prescription coverage over the course of the year. Some people would move in very early in the year. Others would move in mid-year, others would move in towards the end of the year. But no matter when you moved in, a lot of your prescription costs, particularly brand name medications, would move into a higher end tier called the donut hole. And when you're in the donut hole the last couple of years, you would be spending about 25% of the retail cost of that medication. So for example, right, let's kind of digest this a little bit. If you're in a situation where, let's say you're taking a prescription that's a tier 3, it's a brand name medication, and the retail cost of it is $600 a month, well, your 25% would be in the ballpark of about $125 a month if my math is correct there, right? So that would raise your cost from a tier 3 that might have been $45 set copay before that, so go from $45 to $125. And imagine that on multiple prescriptions, that can be very, very detrimental to someone's finances for somebody that's on Medicare that takes a lot of prescription drugs, okay? Now that being said, there's a new system next year. So next year, you might have heard, due to the Inflation Reduction Act, there is now a mandatory true maximum out-of-pocket cost limit on all Medicare prescription drug coverages of $2,000. So what does this mean? What does the true maximum out-of-pocket mean? It means essentially the total cost of your prescriptions, right? So once the total cost of your prescriptions, meaning what you pay and plus what a third party pays, then you have full coverage after that. Now, a lot of people are kind of confusing this to think that you might be responsible for $2,000 in out-of-pocket costs. No, that's not the case. There was a lot of confusion about this kind of when coming into this open enrollment period, in this annual election period. It's the true maximum out-of-pocket cap, which is not your specific out-of-pocket. So it's what you pay, also combined with what the manufacturer pays, also combined with what Medicare pays, all kind of lumped into one, because Medicare is taking on some of the front of some of these costs, and then once you reach $2,000 in that total cost, you're getting there. Now, I've seen all kinds of people so early on in this annual election period where they're spending $700 a year, $800 a year, $900 a year, but that's getting them to their true maximum out-of-pocket cap, okay, of $2,000, even though their personal out-of-pocket was only $700, $800, etc., right? Which ultimately means once you hit that number, your costs go to zero, which prescription-wise, for a lot of people, that actually might end up being a good thing. There was some fear and some skepticism of what we thought this might look like kind of coming into this open enrollment period, that if it was your personal out-of-pocket cost of $2,000, that could raise a lot of costs for a lot of people. But I don't believe that's going to be the case as much as we thought it might have been. It might be the case for some individuals, but not everybody. Now, that being said, what we're seeing is some negative repercussions of this true maximum out of pocket of $2,000. The first one is benefit shifts, okay? We've seen all over the country for Medicare Advantage plans that benefits are starting to shift, right? This is something that we're seeing far and wide. We're seeing plans that had strong dental benefits, pull them back. We're seeing plans that had strong over-the-counter item benefits, pull them back. We're seeing plans that had strong Medicare Part B give-back benefits where they're reducing your Medicare Part B premium and paying it down for you. Those are being pulled back. We're seeing plans that have had low maximum out-of-pockets, low copays for various things. Some of those are pulling them back. Now, I'm not saying it's happening on all those categories with every plan, but each plan on the Medicare Advantage side we're seeing in some way, shape, or form is pulling back one area of coverage. With one plan it might be dental. With one plan it might be vision and hearing. With one plan it might be prescriptions. With one plan it might be their network, right? Cutting some providers and some hospital systems to let them fall out of the network. With some plans, it might be a Medicare Part B give-back benefit. With some plans, it might be their medical coverage and their maximum out-of-pockets having those numbers rise, which means there's more of a patient responsibility to kind of cover the fact that they have a lot more prescription drug costs that they're going to be paying in 2025. Now, about 30 to 45 days ago, Medicare actually came out because they knew that this was going to be coming, and they offered a scenario to essentially provide subsidies and funding to various insurance companies to prevent less of these things from actually happening. So if that hadn't have happened, what we're seeing on the benefit shifts was probably going to be far worse and far greater than we are actually seeing now. So the government passes this Inflation Reduction Act. It's causing all of these benefit shifts to happen. But last second, right before the buzzer, they come in and provide a subsidy to try to put a Band-Aid on the situation and kind of stop the bleeding a little bit. So because of that, we're seeing not as quite of severe benefit shifts as we would have expected, but we're still seeing massive benefit shifts, more than we've seen in a decade. That is a fact. Not only that, folks, not only that, we're seeing plans all over the country have their plans exactly pulled out of an area and cutting benefits and canceling plans for certain individuals. Now, we're not seeing that everywhere, but some areas it's rampant, right? There's certain states that entire insurance companies are just pulling all their plans out of a certain area, and thousands, if not millions of people are being canceled on their plans as a domino effect of this Inflation Reduction Act and the donut hole being gone. Is this a good thing long term? I think for some people it will be. I think for other people it won't be. But I do think that if you're not already and you don't have somebody looking over your plan and your coverage like an agent or an agency, it's probably a good idea to have your plan compared for 2025, because this is a madhouse. This is a madhouse, and this is more shifts and more changes than we've seen in a decade. Again, my name is Christian Brindle. I run Christian Brindle Insurance Services, also known as Everything Senior Insurance. We're a national Medicare specialized insurance agency that works with you specifically. There's no cost for our services, $0. But you get our expertise in helping you shop your options and find the best plan based on your needs and preferences. If you're impacted, or you want to make sure you're not impacted on your plan for 2025, give us a call at 801-255-5340. Again, 801-255-5340. We're happy to give you a helping hand. There's no cost, and again, there's no obligation for our services. Even if we take a look at your plan and it turns out you are in the best thing for next year, we are perfectly fine to let you know that, because we want to make sure that we are only helping you if we're benefiting you. So give us a call, right? And again, if you enjoyed this video and you found it insightful, educational, helpful, makes sense, right? Clearly explained, easy to understand, do us a favor and smash the like button for the YouTube algorithm. It's going to help so many more people just like you find this video who are desperately confused about what's going on right now. Comment your thoughts down below. What do you think about everything that's taking place based on what you're seeing and based on what we talked about in this video? Subscribe. We put out weekly videos to help you understand Medicare, help you understand your Medicare options. And until next time, we'll see you on the next one. Thanks for watching all the way to the end. Give us a call if you need help, and happy Medicare, everybody.